Hi, my name is Caitlin Price. I'm 29 years old and I'm from Valrico, Florida. I'm here with Dr. Lieb. He's from our South Tampa office from Florida Eye Specialists and Cataract Institute. Hi, Dr. Lieb. How are you doing today?
Good morning, Caitlin. I'm great.
Can you tell me how optometry and ophthalmology work together on patient care?
Sure. The relationship and the dynamic between optometry and ophthalmology is very unique. Our fields are not identical. However, there's a massive amount of overlap. There's far more similarities than there are differences. Patients can often come into our office and see an optometrist or see an ophthalmologist and get the appropriate care that they need, whether they see one or the other. However, after an exam, often I sometimes find something in a patient that requires something further, whether that's surgery, procedure, an injection, etc. In those instances is when I can call on our friends in ophthalmology to help continue the care. We're on the same team. The end game is the same. We just want the patient to have the best care available to them.
What are the various types of eye exams that are offered and what conditions are you looking and screening for?
Sure. I think when people think of a classic eye exam, they're thinking of a patient that wears glasses, wears contacts. They're coming in for their annual checkup. They want their glasses prescription checked, confirmed, tweaked, whatever the case may be. And certainly that is part of a routine eye exam. However, that's not it. The second part of that is checking out the health of the eye. We look at the front, we look at the back, we look at the lens, the pressure, the overall eye as a whole. So you have kind of this refractive part, which is the glasses and the contacts, and you have this health part, and you put those two things together, and in my opinion, that basically is your routine comprehensive exam.
Yeah, that sounds very thorough.
Now, with that said, you don't have to wear glasses and contacts to have a routine exam. We go to the dentist every 6 months, whether we have a problem or not, and your eyes are very similar. So we have patients that come in every year, probably not as many as we would like, whether they have a problem or not, and they just want to make sure their eyes are in good condition. So those are your kind of normal, natural, routine exams. With that said, there are also some more problem-specific exams that we do. For example, diabetic exams. I see hundreds of diabetics exams per month. Endocrinologists, primary care doctors from the community routinely send us their diabetics for us to check to make sure there's no signs of diabetes in their eyes. And if there are signs in their eyes that require something further, we work with our retinal specialist to help continue that care. If they have no signs of diabetes in their eyes, or they have a minimal amount that doesn't necessarily require something further, then we can follow them every 6 months or every 12 months. Another subset is glaucoma. We see a large amount of glaucoma patients in the practice. Some of those are also sent in from primary care doctors in the community. Some of those patients already carry a diagnosis of glaucoma. Some of them are just suspicious for glaucoma, so they want us to kind of carry on care for them. And what glaucoma is, in a simple way, is when the optic nerve has some damage to it, basically because the eye pressure is too high. So we can often control that eye pressure simply with some eye drops. And for many people, actually for most people, that works just fine, but not for everybody. Some people need further lowering by other means, whether that is a simple laser procedure, inserting medication directly inside the eye, or last resort basically would be surgery. Probably one of the most common conditions that we see is a cataract. Most people have heard of a cataract, and simply put, that is when the lens that you have in your eye that you were born with, that's been clear for decades, is no longer as clear as it once was. And this happens to everybody. So if your lens gets cloudy over time, then obviously your vision is going to be affected. People complain about overall just decrease in clarity. Street signs are not as clear. Driving at nighttime is a big one. We hear that all the time. The channel guide on the television, reading small print, especially if the lighting is not good. So those are all symptoms that patients tend to develop as the cataract grows. Now, if those symptoms are tolerable and the patients aren't overly bothered by that, they don't need surgery. We can potentially give them a new pair of glasses and kind of buy us some time until they want or need surgery down the road. Now, on the other hand, if those symptoms are bothering people enough that it's affecting their quality of life, they can't do the things that they enjoy doing, then they sometimes want to proceed with surgery, which is great. So in those patients, We simply remove that cloudy lens, we remove that cataract, and we replace it with an implant lens. That procedure has gotten to be quite predictable, quite successful. Patients are usually very happy after they have that done. We also get a lot of patients that come in inquiring about lid questions. They're unhappy with bags under their eyes. They're uncomfortable with their upper lids drooping down. And they want to do something about it, whether it's for cosmetic reasons or whether it's for functional reasons or whether it's for both. And in those patients, we have a great oculoplastics team to help us. Now, similar to cataracts, if it's not bothering them that much, then that's not a necessity. If they just want to know that everything is okay, but they have the option of surgery later on down the road, then that's perfectly fine. Lastly, certainly not least, we see a large amount of macular degeneration in the practice. And I think most people now know what macular degeneration is. It's simply put, it's what the name implies. It is degeneration of the macula. And your macula is the center part of your retina. It's arguably the most important part of your retina. So as you can imagine, if your macula is getting degenerated, this is going to cause a problem. You're going to have some loss of vision likely. So if that progresses and you get some bleeding or some fluid underneath the retina, that's called the wet form of macular degeneration, for which we have some injections. If there's no leakage, if there's no bleeding, we call that the dry form. And until recently, there wasn't a whole lot of treatment for that. But lately, there are some injections for that as well that could possibly slow down that progression. So with those macular degeneration patients, we work closely with the retinal specialist to see what treatment may help them. So, you have that first initial routine comprehensive exam, and then you have these secondary, more problem-specific exams. Now, with that said, on the routine exams, we are screening for all of these things. So it's all one big encompassing family, if you will.
Okay, wow, that sounds very thorough. Tell me a little bit about dry eye and what the treatments are for.
Dry eye. I feel like everybody has dry eye. No, I say that because it's very common. There probably is not a day that goes by where somebody doesn't come into the office with symptoms of dryness, burning, scratchy, quite common. So, the first line of therapy is simple. Over-the-counter artificial tears, easily accessible. They can get them right off the shelf. They don't need a prescription. For a lot of patients, that's sufficient. They can use these tears once, twice, 6 times a day, whatever they see fit. They can use them kind of according to their dosing schedule. But some people, they do this and they still have their symptoms. So we have prescription drops that are available, and some people find relief with those. One thing we do a lot of in our office is the insertion of punctal plugs. We all have a tear duct in our lower lid. We have a tear duct in our upper lid. So with these punctal plugs, what we can do is we can insert a very small collagen plug. Typically, I start with the lower lids and the lower tear duct on either side. So if you're, in essence, blocking that lower tear duct, you're limiting the exit strategy for the tears. They can't leave that duct. They can only leave through the upper portion. So if you're, in theory, cutting their exit by 1/2, the tears are staying in their eyes longer. So patients love this procedure. They're usually very happy after this, and their symptoms are usually much improved. And also, it's quite simple. I hate even calling it a procedure because it is so simple. We do it right in the office, right in the exam room, right in the slit lamp, and inevitably, after I put these in there, patients lean back and they say, "Are you done?" So they don't feel anything. It's painless. It's great.
That's amazing. It sounds very simple to do. How do patients' insurances play a role in their care?
Sure. So most of us have medical insurance, correct? And some people, in addition to that, they have vision insurance. One thing I think that is a little bit unclear for a lot of people is that you don't necessarily need vision insurance to come in for a comprehensive eye exam. We can use your medical insurance most of the time. So, patients often will say, "Oh, I can't come see you, I can't come to that office, I don't have vision." So I think that's just one important point that I'd like more people to know.
Oh, okay. Yeah, I didn't know that either. What are some symptoms that for which you would want to see a patient sooner than scheduled?
Sure. So first and foremost, if they have sudden loss of vision. Anything that is sudden, where Tuesday your vision was good and Wednesday you woke up and it's significantly worse, we would want to see them very, very quickly. Anybody in pain. Nobody wants to be in pain, and we don't want anybody to be in pain. We would want to see them as quick as possible. Thirdly, more retinal type symptoms, those being floaters in your vision, flashes in your vision, curtain or veil coming down over your vision. Those are all potentially problems with your retina. If you Google those things, retinal detachment is going to come up right off the bat. And so if we hear those things, we want them to come in to make sure there is no retinal detachment or other retinal pathology. So those are probably the main ones that we like urgent care for.
Oh, okay, very good. And what can patients proactively do to care for their eyes?
Gosh, first and foremost and most obvious probably is wear sunglasses. You know, the UV exposure that we have, especially here in Tampa, we know that can cause damage to the front of the eye. It can potentially exacerbate cataract formation. It's also linked to macular degeneration. Wearing sunglasses is a very simple and very effective thing that we all should do. In addition to that, as obvious as this sounds, you know, a good, balanced, healthy diet helps as well. Some particular foods in general are green leafy vegetables, kale, spinach, fatty fish, tuna, salmon. You can throw sardines and anchovies in there, but that'd probably be a hard sell. Broccoli, citrus fruits, nuts. Yeah, so those are all very good things for the overall health of the eye.
Oh, okay. And how do contact lens wearers factor into eye health?
So yeah, contact lenses are great, but they have their complications. You know, we have a lot of different modalities that patients wear, whether it's a 1 day, a 1 week, 2 week, or a 4 week schedule. If you ask most doctors, almost all of them will say the 1 day schedule is certainly the most favorable. It's the healthiest. It's the easiest. It requires the least amount of work on the patient's part. And it increases compliance. Compliance being they wear them as they should. They're getting a brand new contact lens every day. That's a pretty easy schedule to follow. You know, the other patients, the 1 weekers, the 2 weekers, et cetera, they inevitably turn into 2 weekers, 3 weekers, and onward. You get the point. So the 1 days tend to stick to their schedule better. And honestly, you wouldn't wear a shirt 2 days in a row, right? But these people wear contact lenses longer than that. So I just think the 1 day is the way to go, because contact lens overwear and non-compliance is a cause for higher risk of infections, and we do see that quite a bit.
And how frequently do you recommend patients have their eyes examined?
Every year. I mean, that's pretty much a no-brainer. We like just about everybody to be seen annually, like I said before, whether they have problems or not. Some patients are seen more frequently than that, depending on what's going on with their vision, but annual exams for pretty much everybody.
Okay, that was amazing. You gave a lot of information about eye care. Thank you so much for coming in and talking with us today.
Great. Thanks for having me. Appreciate it.
Yeah, absolutely.